All right, welcome to Planetary Health First, Mars Next. And we have a really cool topic today. Today we have Christine Caldwell. And do you want to introduce yourself, Chris? Would you do that?
Sure. First of all, let me say I'm so pleased to be here, Michael. I can talk about this subject every day, all day long. So I always appreciate the opportunity. I am the founder and executive director of the nonprofit End of Life Psychedelic Care. I launched it to first educate the public, that's on the consumer side, and on the professional side in the safe and use of psychedelics toward the end of life. And that really includes anyone from a terminal diagnosis all the way to being close to the end of life. So we educate, we advocate for the safe and supported use of psychedelics. And then our third pillar is really to connect. So to connect the professionals together through a members forum. And then next month, I'll launch a public facing connector directory. And then I'll do other work that I feel really will help advance this field, in the sense of I'm working with a physician who does at-home ketamine, and we'll talk about that for palliative and hospice care patients. So whatever I can do to advance this field, that's what I do.
Cool. And I love that you have a home care, a home health background. I think that's so important. You really have empathy. You understand this. But of course, people that are dying don't necessarily have to be older, nor do people that have home care. I know in my little experience in healthcare, there's a big population of those that have disability, and however it be. So what do you think is the most important thing right now? I know I see stuff out of Johns Hopkins, Stanford. There's a lot of research. There's a lot of, I guess you would be kind of the forethought leaders kind of driving this. Kind of what's the framework? Where are we right now? If it's psychedelic 1.0, 2.0, 3, where are we in this right now? Because I know, we've heard about it and, and I've seen it, whether it be in the 50s, 60s, and, all the horror stories with the CIA and all the stuff like that, and Timothy Leary, and, there's been so many different versions. And so I feel like are we back to square one where we can maybe get some good stuff going with the right way? And I'll stop there.
Well, that was a rich question. So, let me start out by setting a sort of context this way in terms of framework. So there's the medical model, and that's what you see in the research. And the research is actually exploding, because you just referred to NYU and Johns Hopkins, and those initial studies came out in 2016. They were with psilocybin. So the other studies you referenced going back to the 50s and 60s was with LSD. And I'll just quickly say that if you have a choice between psilocybin and LSD, where one trip may be 12 hours and the other trip may be 4 to 6 hours, I would say go with the psilocybin, shorter duration for somebody who has a terminal illness or life-threatening illness. All right, so there's a medical model that we see primarily through research, but there's also then ketamine is it's a dissociative anesthetic, but we usually put it into the category of psychedelics, and that's legal throughout North America and Europe. So people do use ketamine in a medical model, and then there's I'll call it legal from a state standpoint. So in both Oregon and Colorado, psilocybin is legal. And so we're starting to see some movement there in terms of psychedelics or psilocybin for end of life. And actually, I'm doing a free webinar, a free panel discussion on that. And then there's decriminalization efforts. So that really says that these psychedelics are the lowest law enforcement priority. And so there's many jurisdictions around the country that, in fact, have decriminalized psilocybin. So then the fourth category, I would say, are churches. So churches operate under this Religious Freedom Restoration Act, a little bit of a gray area, but nonetheless, the federal agencies have, for the most part, left them alone and allowed them to administer, and we'll talk about psilocybin in this case, as a sacrament. So people do have those 4 choices. Now, if I look at that then from a psychedelic perspective, a type of psychedelic, I've already said my bias about LSD, but I normally talk about psilocybin because it's one of the most mystical and very gentle on the body. And as we've just been talking about, most researched in this field, in this specific field. And then I look at ketamine because ketamine is legal. And there are so many real world applications. I mean, it's helped thousands of people, not just people end of life, but thousands of people. And I would, I'd love to get into a little bit more about why that is. And then there is MDMA. So MDMA, from a research standpoint, is best known because of its efficacy in treating PTSD victims. And MDMA, it's anticipated, will be approved by the FDA August 11th of this year. And so we're all looking forward to that. They have shown tremendous results all the way through phase 3 trials. And then the 4th one I'll talk about, not because it's been widely researched, but because it's beneficial when a person is very close to end of life, and that is 5-MeO-DMT. And that's a synthetic version of 5-MeO-DMT because its journey duration is 15, 20, 30 minutes maybe. So for someone whose health is failing, it is a gentler approach, I'll put it that way. And it has to be administered. This one of all the molecules I just talked about, do not ever try this at home without a very trained facilitator, and they use very low doses. So people get to choose. And one of my friends put it as, what is your risk tolerance? So do you want to go the legal medical route? Are you willing to go to Oregon or Colorado where it's a non-medical model? Are you willing to go to a church or participate with a minister from a church? Or are you willing to do this underground?
Mm-hmm. You didn't mention ibogaine root. Can you mention any of that? Because I found that fascinating. I've listened to some other, I've had other guests, and it just seems like it's revolutionized. There's for vets that have traumatic brain injury and post-traumatic stress, and some of them are going down to Mexico. And I know this isn't the topic yours, but I know you mentioned different categories. Could you mention a little bit about that?
Yeah, and I'll throw in ayahuasca too, for that matter.
Okay.
So I want to put it into context though, because ibogaine has been in the news recently, primarily because of the opioid settlement, and Kentucky tried to carve out some of that money to do research in ibogaine specifically for veterans. Now Ohio is taking up the mantle, and some other states are looking at it. Okay, so it gets a lot of press, and it gets a lot of press also because of nonprofits like Heroic Hearts funding veterans to take them, as you said, outside of the country. And ibogaine is one of the treatments. The issue with ibogaine is the hardest on the heart. And when I talk about journey durations, ibogaine can be 24 hours, even more. So to have somebody with a terminal illness, first of all, they would have to fly out of country, which is not, generally speaking, what they want to do. Secondly, that lengthy of a journey. Third, the impact on the heart. No, I would say not at its current stage. And for ayahuasca, also tough on the body. Then I would say no. Again, look at psilocybin or the ones that I talked about.
Yeah, no, I hear exactly what you're saying, because when I heard the conversation by, I guess, Dr. Nolan Williams, if you were going to do something like, and this is not used for what you're talking about for end of life therapy, but it was fascinating. He was talking more so from when I was hearing it, just like you needed to be in a cardiac with the magnesium drip and whatnot for what you were saying. It just seems like there's the others that you mentioned are way more effective, get it going. So, but I just know you started mentioning a lot of these others. So I just thought it was important just for context. So thank you.
Yeah. Yeah.
So where do we go on this journey today? No pun intended.
Well, Well, one of the things I'd like to come back to and make sure your audience understands is kind of like why these psychedelics work as well as they do. And so I'll talk about that from the standpoint of the research as well as the real world applications. So looking at psilocybin, as I said, it's the most mystical, at least when you compare it to ketamine and MDMA. And so it affords an individual an ability to connect with consciousness on a greater plane. And I'll share a story. I'll come back and share a story about that from one of the individuals I know. It brings issues front and center. So quite often you'll hear individuals who have participated in the trials or in real world applications of psilocybin talk to their cancer. They'll have various conversations with their cancer. One of the most famous researchers, Dr. Roland Griffiths, in fact, talked to that after he was diagnosed with stage 4 colon cancer. He underwent a psilocybin journey and basically had a conversation with his cancer. Now, this was a man through his meditative practice who already accepted his death and dying and viewed that actually by itself as a psychedelic journey. But nonetheless, that's what the psilocybin brought to him. Then there's a gentleman, Thomas, who is one of the first Canadians to have received psilocybin therapy through a special Health Canada program. So this is for individuals with life-threatening or serious illnesses that can be approved for psilocybin therapy. Well, Thomas was diagnosed with stage 4 colon cancer in 2016, given a prognosis of 18 months to live. That man has been through hell and back in terms of physical surgeries, 86, 87 rounds of chemo. I mean, brutal, right? Just brutal. He's undergone 7 psilocybin journeys, at least as of today. And so he tells these incredible stories about those journeys. And early on, they were to reduce his anxiety. When he first got his terminal diagnosis, and a lot of other things happened in his life, his anxiety was so debilitating. It was hard for him to be there for his family. It was hard for him to function, quite frankly. So the first couple of rounds of psilocybin brought that anxiety level down so he could function. And he feels strongly that psilocybin, not a cure, has allowed him to redirect his energy into healing, not into anxiety. But the cool story is one of the trips he did talk to his cancer, and his cancer told him, "Do you think I want to be here?" So cancer said, "I don't want to be here." And Thomas has come to call his cancer almost me. He sees it as consciousness as much as you or I exist in this field of consciousness, as he exists in this field of consciousness. And so he says, well, how can you have a fight against yourself? It's not a battle you can win. So he has come to this place of really understanding that the cancer has made him the person that he is, and that his physical body is nothing more than a physical body, and that he in consciousness will live on. And he brings that to his family, he brings that to his friends, he brings that into his whole life. That's psilocybin. If I look at MDMA, again.
Did I hear you correctly? You said almost me?
That's what he called his cancer.
Okay, that's fascinating. Okay, gotcha.
Yeah. So now MDMA, street name Molly or ecstasy, and as I had said, was mostly studied for PTSD, was first used in couples therapy before it was put into Schedule 1. So it was put into Schedule 1 in 1985, but it was used in couples therapy because MDMA, we call it an empathogen. It opens the heart. And it opens the heart not just for self-compassion, but for other compassion. So as you can imagine, if you have received a terminal diagnosis, some of the many things you start to worry about is, I can't forgive myself for the things that I've done. I can't forgive some other people for the things that I've done. And my relationships with my family aren't the best. So if you have a medicine that can actually help you open your heart, be open to others, forgive yourself, it's incredible. And there is a study ongoing right now with Sunstone Therapies out of Rockville, Maryland, where an individual wrote an article that was published and talked very eloquently about MDMA helping him overcome his fear of dying and improving the relationship with his wife. What's cool about this study, it's the first one where it's a couple study. So one of the members of the dyad has to have cancer diagnosis. The other one can be significant other, spouse, adult child, but they undergo the exact same protocol, MDMA. All right, so now let's look at ketamine. Ketamine is fascinating because, as I said earlier, it's a dissociative anesthetic. And what it does is it separates your mind from your body. And instead of bringing issues front and center, it gives you this ability to be an observer. And a lot of times, if you studied psychotherapy modalities or coaching modalities, we talk in terms of taking that observer position and being able to resolve issues as an objective viewer. What it also does as a dissociative anesthetic is you die before you die. So people have a sensation of dying before they die. And in so doing, when you're working with a trained facilitator, you overcome your fear of dying. There's a woman who was diagnosed with stage 4 cancer a few years back, started to undergo ketamine therapy. She conscientiously says in her intention, I want to die today. So when she undergoes a ketamine journey, she, from her perspective, and her perspective is reality, right? In terms of what she experiences, that she dies, she's on the other side, she's comfortable with it. Fast forward, she now got the bad news, she has it's end stage. So she continues to use ketamine to bring her that comfort that dying is okay. Then there's 5-MeO. 5-MeO also is called the God molecule. So it shoots you into this collective unity consciousness in the 15 minutes you're on it. Again, very careful administration, but for an individual closer to the end of life, it can give you that sense of being in a field of consciousness, being independent of your physical body. So, there's just some minor examples, or a few examples, I should say, of what these psychedelics can do. And there's thousands of those stories.
Mm-hmm. So Chris, after we finish, are you able to provide some of these resources you're mentioning, so I can put that, I'll put up, our video, our recording, these references and links. I think it's so hard to capture all this. You're like a PhD on this. I know you don't get a PhD in this, but of course, it's just fascinating. And I know you didn't grow up thinking this is what I was going to be when I grew up, but it's just fascinating.
Oh, exactly. Yes. So I talk on this subject all the time, and I have several videos, for example, or there are resources I can provide for anybody, especially if they want to dive into the clinical trials, which, by the way, also clinicaltrials.gov lists every single trial that is either in recruitment phase, will be recruiting, or, has completed and there's published results. So if you go in and somebody, or you yourself are interested in a clinical trial, then you put in keywords like psilocybin, like cancer, like existential distress, and you'll find the list of trials. But again, I can provide a link to the list of them.
So obviously you're fairly new on this journey. It's a few years, I think 2020 when you started. I mean, I know you've had some interest in the contemplative and meditation, and I think I read something about the Chopra and some other stuff. So, I mean, you're not, you were open to some of this, but this is fairly new. And where do you see yourself going on this journey professionally? I see you're more of a facilitator with your nonprofit. But tell me a little bit, like kind of now where you are and where you see yourself going.
Well, I'm going to continue to expand our educational offerings. My offerings are specific to training a person to be an end-of-life doula or a death worker. So an individual who really advocates for, sits vigil, mediates family relationships, develops legacy plans for someone toward the end of life. So that kind of training. And then for that, an end-of-life doula or death worker, plus anybody who's working in a end-of-life related field, like a hospice or palliative care nurse, or wants to, or is interested in it, or a mental health therapist, then I'm offering the courses, again, at that intersection of psychedelics and end-of-life. So whether that's on spirituality, on bereavement, which is a whole other kind of application for psychedelics, is in the use for bereavement. So the people that are left behind when a loved one passes. So there's the educational piece, there's the advocacy piece. In fact, I'm planning on moving to Washington, D.C. to begin expanding my advocacy work, because I think that that's really, really important. And at the federal level is a good place to start. And then I think on the connecting side, it is building out that connector directory, and the people, the professionals in that directory are trained in both end-of-life and psychedelic care. So that's really important to me, that individuals know that coming into it. And then to build a discussion group for people who have a terminal or life-threatening illness, whether or not they have participated in a psychedelic journey, but they're curious about it. But it's an ability for people with the same circumstances to share, to bond with each other. So there is that. And then, as I said up front, it's like almost anything that I think can help advance. So I'm really interested in projects, in research studies, surveys, for example, that will do that. And one example is just early days in developing a storytelling project. And it's going to be with the end-of-life doulas or the hospice chaplains or nurses, where they talk about what they've learned from those who are dying, those they have witnessed. And that's going to be powerful, because there's a gentleman, Stephen Jenkinson, who teaches about death and dying, one of the foremost authors and teachers on the subject, who says that the greatest gift that a dying person can give their loved ones, and by extension the world, is what does it mean to die? You know, what is it that you go through? So not who better, because the specific individual themselves would be great, but the people I know have witnessed hundreds of journeys of this type of a journey in terms of transitioning and passing. So I want to do something like that. I want to do a project where we're collecting the wisdom from the people who are already doing this, and a specific project on ketamine therapy with palliative care physicians and nurses. Like, how do they treat people in palliative and hospice care? So to collect that wisdom that sometimes gets promulgated but doesn't get collected and made into meaningful data or information. So yeah.
No, that's super important, because the sad reality, it seems like everything's out there. The information's out there. It's just a matter of finding it. And it's not just like Googling it either, in a meaningful way, curating it. So that is so important. And then the right people, giving the right people the right information, the trainers, those organizations. So really, I also could imagine one of the biggest applications to what you're doing is really for depression. I'm hearing that's the biggest thing that the area, correct, with psychedelics, with PTSD, traumatic brain injury, the ability that it could serve much more effective for those sort of conditions as well, correct?
Right. And you know, we talk a lot about comorbidities. And so, yes, say an individual with PTSD, but typically would have generalized anxiety disorder or major depression disorder. So yes, psychedelics are considered to be transdiagnostic, and people would argue, let's get away from the diagnoses entirely. But in any case, you take a patient in palliative care, and certainly between their diagnosis raising anxiety to levels that are debilitating, you also sometimes have severe chronic pain. And we know that severe chronic pain goes hand in hand with depression. One drives the other both ways. And so if you can reduce the depression, very often when working with a trained mental health therapist, you can reduce the chronic pain. You can reduce the chronic pain, you can reduce the depression. The ketamine is the probably proven the best because it's been used to treat chronic pain for decades now. So it's used very efficaciously to treat depression and chronic pain in palliative care patients. Psilocybin, those studies on chronic pain are just beginning. So I think they hold great promise, though.
Do you know much about the veterans right now, the VA using any of these things for death and dying, particularly as a cohort, or just these treatments that you'd like to share?
Well, interesting you should say that. I just participated in a conference in New York City, and the undersecretary, and I'm sorry, I'm forgetting his name, of the Veterans Administration actually spoke. And they are now gearing up to do research with veterans. And that's a huge leap for them, because their trials or their protocol was typically prolonged exposure therapy with cognitive behavioral therapy. And that efficacy was, I'm going to say, no more than 50%. So now you have a treatment that is shown to be especially efficacious. So that's huge. Now, have they extended that into end of life? Not yet. No. But I do think, I mean, you remind me, psychedelic therapy for veterans has bipartisan and bicameral support. It's one of the few things that has bipartisan support, as you might know. And so that's one of the reasons why I want to go to Washington, D.C., because we all die. Right?
We do?
Yeah, sorry.
We do.
Sorry.
Well, I don't know. I just had the other day someone on longevity. No, I hear you, but there will, at some point, it's fascinating with science and technology and cyborgs, and I mean, who knows? For right now, let's just say. Gosh, there will be in 50 years, who knows, 60 years, the technology. I don't know. I don't want to be, anyway. All right. Yeah. That's another topic.
One other comment on veterans. What I also absolutely love is the emphasis on, yes, as I said earlier, we're sending our veterans, the people who have served us, out of country for the treatment that they so desperately need, and has shown to work, right? I mean, the stories about the veterans is just phenomenal. So one of the things I really, really am grateful for is that in the state of Oregon, where it's a non-medical model, so actually anybody who chooses to participate in a psilocybin journey can do that with no diagnosis. Well, the first veterans retreat was held last November in Bend, Oregon, and it was sponsored in part by Heroic Hearts. And so we will see more of those as well within the United States.
Yeah, to me, it seems like, that's what healthcare is, that's what's serving and doing what's right, and if the data and evidence is there, but gosh, I tell you, lobbying and PR is so powerful so many things in our country, unfortunately, I think have just been, and I don't want to go down that rabbit hole, but the evidence is pretty, like when you have these Navy SEALs that go to Mexico and they're telling their friend, look, my life has been transformed. I can function again, or whatever it is. And you can, I'm sure way better than me those stories. It's something to be looking into. Why not?
Yes, exactly. And I did want to mention, this research with MDMA for PTSD. Yes, we tend to focus on the veterans, but there's far greater numbers of domestic violence and sexual abuse for PTSD victims that also needs to be addressed.
Thank you for, bringing that awareness. This is something. And then when you said, I remember you saying 50%, I forget what was that for, but that's really the rate of treatment currently for depression. It's a coin toss whether it's going to work. So we definitely need more modalities that work, or more effective, and better understanding. I didn't know it until I listened. I learned most by consuming people way smarter like yourself than me on podcasts. And there was something like there's 7 or 8 modalities of depression. It's not just like you're just feeling down. It's way more anxieties involved with it, whatever the different aspects. So when the brain can, this whole chemical imbalance is just so not, that's like 1.0 psychology. It's not Freudian. I mean, yes, talking makes you feel better, but we're hopefully, and you're part of it, a new science and a new realm of where we can go with really getting people the right level of care for what they need that works.
Yeah, you're reminding me too. So this notion again of a transdiagnostic approach, and potentially getting away from the diagnostic type of approach. And so, yeah, let me bring it back to people toward the end of life. There may not be any diagnosis. What's important is then maybe it's up to the individual, a spiritual experience and a consciousness raising experience. And that, I think, is every bit as valid as somebody who's been given a diagnosis. I think another aspect of this too that you remind me as you look at people with mental distress, whether they're at end of life or not, is the environment they're in. So again, specific to people toward the end of life, you've got religious beliefs that may dictate that your fear of going to hell, or that you did something wrong in God's eyes and you will suffer as a result of that. Or you have family members who want to prolong your life for their own reasons when your quality of life is totally gone. So to be able to, and again, psychedelics are not a cure-all, or they're not the only tool that can be used. But if you're looking at using psychedelics to do these things like I'm talking about, opening the heart, asking for forgiveness, gaining forgiveness, educating the family members, bringing in a hospice chaplain an interfaith hospice chaplain who really understands what it means to die and certain religious beliefs, and can help people shift their narrative about a vengeful God or whatever it happens to be. And psychedelics can help. So whether a family member, for example, chooses to participate is sort of irrelevant. It's up to them. But to educate them in the preparation phase, and to educate them on what we call the integration phase, and go, your loved one may come out different. They may want to take back control of their life. And it may be difficult for the loved one to understand or deal with that. But it's really important. So this whole environment, this whole matrix of factors that goes into a person's mental, emotional, spiritual health.
I love the thing you talk about, opening the heart and forgiveness. So what do you think's going on? I mean, I know we don't know really how it works, the psychedelics, but what is some of the theory or conversation about this opening of the heart and forgiveness that's so important?
Well, okay, so MDMA is the one, as I said, was considered a heart opener. And it's a bit of a controversy, because some researchers will say oxytocin is the reason. Oxytocin is that bonding hormone all mothers feel when they give birth. And so that sort of can flood you with the feelings of love and acceptance. But other researchers don't believe that. So what is it about MDMA? That's a really good question, because MDMA is a very different psychedelic. in that it is the only one that increases the activity in the cerebral frontal cortex and simultaneously reducing the amygdala, or the, reducing fear in the amygdala, which is why it's so good for PTSD, because an individual is still cognizant. You don't really have the types of hallucinations or visions that you see on the other psychedelics. In MDMA, you are able to confront your fears, your trauma, be able to talk it through and find resolution with the fear being reduced. So whether that has something to do with it, I don't know, but it was interesting. Like I said, it was used in couples therapy before it was put into Schedule 1.
I know I've heard mention of other, like Ibogaine, which is so extreme with the recording, the observation. Do you think there's a little bit of that too, the reflective process where you're able to step outside? And is there an element of that, this cognitive resetting too, with some of these, and based on the,
Yeah. Okay. Since I'm not a neuroscientist, I hesitate to say words, but by that I mean cognitive resetting, because some people will say it resets the brain, and again, you've got other neuroscientists kind of saying, no, please don't say that. But there is something. There is clearly something with these psychedelics that allow you an opening. Typically, we talk more specifically about neuroplasticity. So our ability to learn new things, our ability to learn new thought and behavior patterns, all the psychedelics can help us with that, including Ibogaine. And so, there is that potential that when you are open to reviewing those triggers, and you shift the narrative, I look at it in two different ways. There's mind practices. You shift the narrative. Was this really true that everybody hated me? No, maybe not. And then there's the embodiment or somatic processes that also help you deal with your trauma. So it's a reason why when you take psychedelics, it's not the end all be all, that then you might have to really think about, well, how can I shift? How can I embody that feeling of transcendence I felt under the journey? How can I bring that back into my body? So there is that on an ongoing basis that people need to look at. I mean, it's different depending on, of course, where you are. If you're closer to the end of life, you're not going to be working on your 6-month goals.
So I'm curious about like bitterness and angerness, those things that get in the way. Is there any of that releasing? Because I know the fear and the anxiety you mentioned heavily, but it seems like there's certain things that many of us can, struggle with, the resentment or whatever it is, those sort of blockages. Can you anecdotally kind of share something about that? I'm curious.
Yeah, well, the bitterness can take and anger can take a lot of different forms, or the cause of them can be very different, right? And again, I don't want to say psychedelics are a cure-all, and an individual has to be open to this. You don't go into this a bitter person and going, I'm going to be a bitter person and change just because you took a psychedelic. So if you're open to it and you set your intention to deal with that, to get at the bottom of that, then your chances are much higher that you'll be able to work on this. And like I say, the bitterness can be caused by different reasons. And I'll share another story about an ALS patient, advanced stage ALS patient, who received ketamine therapy in his home by a palliative care physician. And in his first journey, he felt released from the confines of his body. He felt himself playing, leaping, jumping, running, just joyously doing these activities that he's obviously not able to do with advanced stage ALS. And so the physician had given him 2 treatments of ketamine. And in the second one, he then came to a position of gratitude for his life. And the physician was to administer a 3rd session. And the evening before that, the gentleman died peacefully, died with peace. And so that to me is a different example of bitterness that I think is every bit as important and resenting. And that's clearly true of people who have been given a cancer diagnosis. And if you can get to Thomas's revelation that cancer is consciousness, it's here to teach me something, then the anger, the resentment dissipates.
So I guess really what we're getting at is the ego is not our amigo. Like trying to figure out how we can dissolve this ego. I mean, even like, so I mean, it's the, and it's not just, and I hate to use that term ego, but it's just the construct of what we see. Because I mean, these are universal struggles that us as being human that we get in the way of. So it seems like it's a universal way to help us as humans engage with our flawness. And so.
Yeah. I tend to stay away from using the word ego too, because generally speaking, it's kind of makes us what we are, probably is what makes me driven to do what I do. But I think of it more in terms of we feel there's a separateness between us. That's where I would go. And psychedelics can help you understand that we're all connected. And I think even more, not more importantly, but just as importantly, we're connected on a humanity standpoint, but also with all of nature. And so psychedelics can bring you back in touch with nature, all living things, basically, and gain a perspective and an appreciation for that. And that goes a long way, I think, to helping us. And clearly there's an epidemic of isolationism, mental health disorders, clearly because we feel isolated. So yes, I do see psychedelics helping with that as well.
Well, I don't know your time. We still have a little bit of time. I don't know where you are, but on your schedule today, I would love to allow you to I want to make sure, as you know, I'm pretty much unscripted, but we have been covering much of what you do, but I want to make sure we get it right. I mean, not that, but this is your time to help us understand.
Yeah, I really, really, really appreciate that. I think it would be great for people to help advocate at the state and at the federal level to whatever degree they feel comfortable. There's legislation pending in about 16 states at my last count, as well as at the federal level. And I'm all for the safe and supported use of psychedelics, especially when it comes to individuals toward the end of life. So to advocate, I think, is important. I think, one other thing that generally speaking comes up, and let me just, health considerations, health contraindications, myths and misconceptions. All right, so of course, across the board, there are some health considerations and contraindications that don't only apply to people toward the end of life, but unregulated high blood pressure, for example, is a no-no, because all of these medicines increase the heart rate. If you have severe asthma, many times physicians are loath to administer this medicine. For others like ketamine, severe kidney or liver disease, because of the way ketamine works on the liver. and then, ruled out in all trials, or the older trials, were schizophrenia, any psychosis. So bipolar 1, schizophrenia, borderline personality disorder. And so that still is there. And so anybody who is suffering from those, or active suicidality, anybody who's suffering from those, needs to proceed with caution and needs medical clearance clearly. However, I will say I'm really pleased to see that there is research planned for those, that it's not necessarily a rule out. It was a rule out for the clinical trials. So there's those health considerations, and then there's the discussion of drug interactions. And there are things like lithium, which can greatly increase the risk of seizures on psilocybin, but yet combined with ketamine enhances the efficacy of ketamine. So knowing what medications work and don't work, a big thing that was ruled out for many of the clinical trials too was SSRIs and SNRIs. And people are really coming to understand that people do gain therapeutic benefit even when they're on SSRIs or SNRIs. And sometimes, not always, you may have to increase the dose. Say specifically, let's talk about psilocybin. But that it's a first do no harm approach, in the sense that to have someone come off of an SSRI who's been on them for many years, those withdrawal symptoms can be horrible. Mm-hmm. So to allow them to stay on their SSRI or SNRI and still participate in psilocybin has been found to be better. Now, they can use psilocybin or other psychedelics to wean off of their antidepressants. So that's something as well. And so a couple of other sort of myths or misconceptions that people will lose their mind. And again, for me, looking at people toward the end of life, you're given a terminal diagnosis. Well, you already feel like you've lost control of your life. You've lost control of everything, right? So the last thing you might want to do is take a psychedelic where you're afraid you're going to lose control of your mind. Well, I will say, generally speaking, that does not happen. You're on a journey of limited duration, and you will come back. People do speak in terms of, I hope I get this right, hallucination, persisting perception disorder, HPPD, which in retroactive surveys have been found to occur in 1% to 4% of the people who take psychedelics. And of that, half of the individuals are on LSD. And this is all unsupervised journeys, for example. So there is that risk, but it's very, very, very low and should be put into the context. And the other thing in terms of advocacy that I'm glad I remembered this is the reimbursement, or the lack of a reimbursement model. Mm-hmm. You know, for right now, psychedelics are for the people who can afford them. Mm-hmm. And I'm glad to see that states like Oregon have an equity model where a licensed service center must have equity programs in place and show a sliding scale, or offer services sometimes for free. So that's really good. But we need insurance to step up and support this. And people are actively working on that for MDMA, definitely because of the anticipated approval by the FDA this year.
And so
thank you.
Thank you for sharing all the, I guess, disclaimers, right? I mean, It's really important to know. Well, geez, like we all see them on TV with every pharmaceutical medication. Sounds like any of those you would never want to be on, right? It's like, gosh, may cause you to whatever, all
die.
Those. Yeah. So with your advocacy, I imagine, are you having a unified approach? Obviously, your focus was within the the death and dying space, but just hallucinogenic psychedelics in space for clinical trials and medical use in general. Is that kind of the approach, and just different buckets within that?
Oh, that's a good question. I'm learning as I go. Okay. And I want to expand my efforts clearly, as I've been saying. And so there is a need to join forces. I've already reached out to the gentleman who's an executive director for one of the advocacy organizations for veterans. And so whatever I can do to help, I want to help him as well as learn the ropes. So yes, and as I said earlier, we all die. So there are efforts there for the BIPOC population, for LGBTQ population, veterans, all very important, and end of life. And we all die. So I would really like to see us join forces and advocate across the board for equitable and affordable access.
Yeah. I just know there's so many special interest groups, and it's just like every day there's a new one. So I would just hope that, for mental health and all the other different areas that can be benefiting from this, that if you guys could unify and really be more effective, I don't know, maybe I'm ignorant. I'm not, I live about 4 hours away from DC, but I know nothing of it. So.
Yeah. Well, ignorant or, hopeful, that's not the word I'm looking for. Yeah, I'm a pragmatic idealist, so why not? We're gonna shoot for it,
Well, Chris, thank you so much for coming on. Anything, how can people find you, get to know more about you? What's the best way, other than I know afterwards on my newsletter, I'll put information, but while you're here?
Yeah, well, my nonprofit End of Life Psychedelic Care, the website is eolpc.org, and I can be reached at Christine@eolpc.org. So easiest way to get in touch with me, but I would invite your audience to check out the website, check out our offerings, and connect with me.
Awesome. Well, thank you so much for coming on. Until next time, friends, on Planetary Health First, Mars Next.
Thank you.